As you would be well aware, Singapore and Hong Kong have been in discussion on an air travel bubble since last October, when vaccinations were not yet available. The progenitor of it is sitting beside me here from the Singapore side. Unfortunately, we have not been able to launch the ATB due to the surge in community cases in both our cities at different points in time. In Singapore, a substantial proportion of our population is now fully vaccinated, as you've heard. Hong Kong, too, is progressively vaccinating its population. Both sides are focused on keeping our population safe and minimizing the risk of imported cases. But our strategies differ, with Singapore now taking steps towards becoming a COVID-resilient nation. Against this backdrop, my Hong Kong counterpart, Secretary Edward Yao, and I have discussed and concluded that we will not be able to launch or sustain the air travel bubble in its present form. We remain committed to facilitating travel between Hong Kong and Singapore. We are both financial and aviation hubs with close economic and personal ties, and it's important to re-establish general travel between Hong Kong and Singapore so that our people and businesses can reconnect. In this regard, earlier this month, Hong Kong announced revisions to its overall border policies, and this includes a shorter quarantine period for vaccinated travelers from Singapore. On our part, Singapore will unilaterally open to visitors from Hong Kong, which is in Category 1. Similar to visitors from other very low-risk countries and regions like mainland China, excluding Jiangsu province, New Zealand and Taiwan, visitors from Hong Kong will be allowed to enter Singapore with just an on-arrival PCR test. We will also extend this unilateral opening to visitors from Macau, which is also in Category 1. Visitors from Hong Kong and Macau will be allowed to apply for entry with immediate effect for entry into Singapore a week later. So let me summarize what all this means for our travel landscape. First, Ministry of Health has established a risk-based categorization of countries and regions with attendant border measures. This is the baseline setting for all travelers and the foundation upon which we will assess further reopening moves. We commenced last year with unilateral openings to very low-risk countries and regions. We now add Hong Kong and Macau to this list. With this, we would have allowed general travel from all Category 1 countries and regions, subject to an on-arrival PCR test. We will augment this framework with the launch of vaccinated travel lanes for Germany and Brunei. This is a new modality in our reopening, which has been enabled by the progress in vaccination in Singapore and other parts of the world. We will implement the vaccinated travel lanes cautiously. We are starting with 2 countries with designated flights and a set of essential safeguards. This will allow us to learn from the experience and enhance our processes before any further expansion of the scheme. I know that some Singaporeans would want us to move faster on the vaccinated travel lanes. I also know that others may be concerned about the risks of such reopening measures. To those who want to do more, I ask for your patience. At this juncture, it is more important that we get it right than that we do it fast. The experience gained from implementing these initial moves safely will enable us to later extend the scheme with confidence. To the Singaporeans who are concerned, I seek your understanding. We are moving in a measured manner, starting small with 2 countries and an essential set of safeguards. the safety and well-being of our people will always remain our utmost priority. We will not throw caution to the wind. Above all, we seek the support of all Singaporeans for these measures. As an open and small economy, our connectivity with the rest of the world is essential, if not existential. That is why we need to start reopening. The longer our borders remain closed, the greater the risk of lasting damage to our economy, our livelihoods, and our status as an aviation hub. We will continue to take a cautious, calibrated, step-by-step approach to reopening our borders, always mindful of our public health objectives. And we are fortunate to be embarking on these moves with more than 75% of our population fully vaccinated. Ultimately, we want to safely and progressively reopen our borders and resume air travel to build public confidence and ensure that these arrangements are sustainable as we journey towards a COVID-resilient nation.